Hi and welcome. My name is Thorsten Lehmann and I work for the company H&T Presspart as a business development manager. One of my responsibilities is the area of connected devices, and I'm glad to have the opportunity to present today on putting the patient first using innovation. Let us start by having a look at what I'm going to talk about. At first, we will understand that the investment in digital health continues to increase. That correlates with the fact that the field of home care gains more and more importance. Secondly, using the example of asthma, I will explain how medication non-adherence affects both revenue opportunities and personal health outcomes. By the end of the presentation, you will have understood what the smart inhalers 4Ps are and how they can help improving medication adherence. You will watch a short video on Presspart's embedded smart inhaler before I end the presentation with a few slides on inhalation flow measurement. Now, to begin with, I would like to invite you to imagine how our world will look like in the future. A future where we hope to treat illnesses and health problems using state-of-the-art technology. And once you are thinking about it, ask yourself the question how the typical patient will probably look like. Well, I don't think that there will be a typical patient. However, the patient will be old for sure. Since 1960, life expectancy has risen by 20 years. And with the world population aging fast, there will be more than 1.4 billion senior citizens in the world by 2030. And with life expectancy increasing, a respective number of elderly people will be living with various chronic ailments, physical disabilities, and mental incapacities. This is illustrated here in the chart on the right, where people in Europe self-reported their health problems. So, depending on the disease, they would require long-term medical attention and care. Hospital care, though, may not be a practical solution for all the needs of the elderly. And this is where the focus turns to home healthcare. Over the past few years, home healthcare has emerged as a dominant part of the healthcare sector. Technology is setting the stage for some extensive changes in this space, like assistive and monitoring devices, mobile laboratories, just to name a few. With these technologies playing a critical role in disease detection, management, and treatment, it is sure that they will also help in optimizing service delivery and standard of care. The future of home care looks promising, especially in the case of chronic ailments such as heart failure, Alzheimer's, and COPD. The self-management of health will become more of the norm than the exception in the future, driven by our aging population. It becomes clear that the digitalization of health and care complements one another. If carefully designed and thoughtfully implemented, digital health has the potential to improve health and care outcomes. Some of us might be already part of it or might have experienced at least the fact that the sharing of digital health data leads to improved and faster availability of medical information. And in turn, this contributes to higher quality therapeutic decision making, as well as to an increase in the process and performance quality of health services. The demand for teleconsultation platforms in Europe, for example, has multiplied. It got reported that medical video chat tools are used for tens of thousands of consultations a day. If people are to live longer and better, we will have to rely on research and technology, the same combination that we are currently using to contain the COVID-19 pandemic. On the previous slide, you have seen the statement of Greg Chittum, who co-leads digital health practice in the US. He said, investment in technology for the home is really accelerating across the spectrum. It's cardiac, it's diabetes, it's respiratory, home dialysis, and even things like wound care. It probably will not surprise you to learn that digital health is on the rise. Global digital health market revenues in 2026 are expected to account for more than 900 billion euros. The chart you see here on the left defines digital health as both hardware and software applications, smartphone apps, telemedicine, and IT systems. The bigger chunk will be made outside of Europe, and it would be interesting to know who of you is actually working on digital solutions. Let us now have a closer look at how we understand today digital health characteristics and advantages. We believe that in the long term, digital health will increase efficiency and can therefore save costs, lowering administrative expenditure, eliminating hospital room expenses, and avoidable diagnostic or therapeutic intermediations are just a few examples. Digital health already is some kind of ongoing medical education for both physicians and consumers. Increasing efficiency implicates not only decreasing costs, but at the same time improving the quality of services. Therefore, digital health may improve the quality of healthcare by allowing comparisons between different providers. Digital health encourages a new link between the patient and health experts. And lastly, by making the knowledge base of medicine and personal electronic records easily available to users over the internet, for example, digital health uncovers new opportunities for patient-centered medicine. And we think that it matches people's today mindset. People are no longer willing to be passive recipients of healthcare services. They want to play a more proactive role in health management. And we believe when patients have access regularly to their health information, they can get empowered to take care of themselves more actively and more frequently, and be more engaged in self-care decisions. I assume that some of you are likely using your phone or a watch to track some health data. Well, yeah, you followed the trend just right. Wearables and smartphone apps for recording, monitoring, and storing specific health data are becoming increasingly popular. According to the forecast you can see here, global sales in the mobile health segment could rise to almost 250 billion US dollars in 2025. But it is not only about smartphones and watches, it is across the spectrum. Currently, there's a wide range of digital healthcare solutions developed that could offer great opportunities. Not surprisingly, our product today, smart inhalers, belongs to the top tier for product development and production. Going ahead, I will use asthma as an example to elaborate on the potential of smart inhalers. I will be very brief on asthma itself, as I assume that you might have a good understanding of asthma and its challenges. Still, this chart here has a clear message. Respiratory infections continue to have the highest incidence rate in Europe. Of course, it gets reflected globally if we take asthma into account. There has been a sharp increase in global cases, morbidity, mortality, and economic burden over the last 40 years. We know that approximately 300 million people worldwide currently have asthma. And what it really means is that despite the efforts of the past few years, we have not yet managed to reduce the incidence, and neither the mortality rate. We must keep working on it. So, as you know about asthma, I assume that you know about the relationship between non-adherence and associated healthcare costs, which is shown here. Medication non-adherence leads to poor outcomes, which then increase healthcare service utilization and overall healthcare costs. The financial pressure could be passed to patients by payers through higher co-payments. And the challenge of patient adherence is growing in importance in the entire healthcare world. Increasingly, patient non-adherence is becoming a severe issue, leading to high costs for the healthcare system and the pharmaceutical industry. Thereby, adherence is highly variable. Between 30 to 70% of adults and children with asthma do not take their asthma medication as prescribed by their doctor. though the factors of non-adherence are diverse and they could relate to the patient, the healthcare system, the therapy, or the disease itself. I've already mentioned that patient non-adherence leads to costs for the pharmaceutical industry as well. Actually, the bulk of pharmaceutical profit loss, if we can call it like that, is due to poor medication adherence. How so? The first impact of patient non-adherence on pharma companies is direct, resulting in lower sales on account of lower drug consumptions, since prescriptions got never filled and medications got not taken often enough. The second impact is more long-term in terms of loss of brand equity. Patients' non-adherence results in a real-world perception of a lack of efficacy and a lack of safety. Let me show you some numbers to make my case. There's a very interesting report on this topic. Even though the numbers might look a bit outdated, they're from 2011, I still believe it's suitable. The data got collected in the US, and this chart shows the major therapeutic classes and their respective revenues in million US dollars. For you to know that the analysis was done solely on chronic diseases, not acute ones. Using an estimated mean adherence rate, it was possible to quantify the estimate of revenues lost in this therapeutic area. It is important to understand that the calculation of losses due to non-adherence is based on revenues that could have been earned, not actually earned. So, as an example, in respiratory agents, US pharmaceutical revenues totaled 21 billion US dollars. Considering the estimated mean adherence rate, the estimate of revenue lost in this therapeutic area is 46 billion US dollars. Extrapolated to the global pharmaceutical market, revenue loss is estimated to more than 560 billion US dollars. That is the bar in the middle in the chart on the left. Increasing adherence rates by only 7%, for example, by using smart inhalers that would maybe require less doctor visits and less hospital admissions, that 7% increase would translate into a 40 billion pharmaceutical revenue opportunity globally. But even more important, it will help to improve health outcomes and decrease healthcare spending. I feel it is worth continuing to think about how to increase patient adherence to medication. This is a good occasion to talk about smart inhalers and how they could help to save costs and to increase both revenues and patient centricity. This brings us to the 4Ps. In marketing, the 4Ps stand for price, product, place, and promotion, the so-called marketing mix. Here we use it in another way. Data from connected inhalers have the potential to improve precision, penetration, personalization, and prediction of asthma and COPD. Precision stands for a more reliable and accurate real-life inhaler technique and adherence information that would be key to support clinical decisions. We understand penetration as a remote technology that will allow us to better understand how patients use their inhalers in real life. Objective data can provide personalized information about a patient's inhaler medication use to patients themselves, to caregivers, and to healthcare professionals. And as the last P, the real-life usage data can be used to predict if disease control gets worse and even the likelihood of an exacerbation can occur. To wrap it up, smart inhalers can help to pave the way to a win-win-win situation for users, the pharmaceutical industry, and healthcare providers. Our friends from Propeller Health have already illustrated some opportunities for smart inhalers. Reduction of hospital admissions, improvement in controller medication adherence, increase in asthma control, and the reduction in rescue inhaler use. Let us now think back about the patient in the future from the beginning of the presentation. An aging world population gets offered home care treatment, technology, and digital health. This could mean that some patients may well be engaged and motivated by the collection of data related to their medication. This feature might then increase the market share of a drug where the patient has a choice of medication. This, in turn, can lead to improved medication adherence and hence reduce the revenue loss to the pharma company. If this can be shown to improve clinical outcomes, then the healthcare payer starts to gain a benefit if this reduces higher costs associated with disease complications. Now, what is the take for us from H&T Presspart in all this? Presspart is very active in the field of respiratory devices for more than 45 years. We have very well-established businesses with major pharmaceutical companies. As a matter of fact, we are both highly interested and involved in the treatment of respiratory diseases. Our portfolio consists of development support, including CT scanning, mold flow analysis, and computational fluid dynamics. We can perform high-quality testing with our fully equipped state-of-the-art laboratory. We currently have more than 30 molding machines and more than 15 assembly stations. Using all these competencies, we want to support the development of your own digital healthcare solution. We have developed a first smart inhaler prototype. The inhaler tracks and records data in the use of medications. We believe that this is already one step towards improved patient adherence. Furthermore, this data can be shared with physicians as the device can integrate with a mobile health app. Let us watch how our EMDI works. Now, it is well documented that patients often have problems adopting the correct inhaler technique and thus receive insufficient medication. Research findings show that the two biggest errors when using an MDI are both related to patient inhalation. The first error is related to the coordination between inhalation and triggering the dose release of the inhaler. The second most significant error is not breathing deeply enough. So there is a big opportunity for technological innovation to reduce these common errors by measuring patient inhalation airflow. Together with the Swiss-based company Sensirion, we are working on the integration of a flow sensor to our smart inhaler. Sensirion is the leading manufacturer of high-quality sensors and sensor solutions. Their sensor offers highest accuracy and resolution, especially at low differential pressures, conditions which you find in an MDI setting. I would like to use the last few minutes to present on the great potential of flow sensors. Here we see the inhalation profile of a patient over time. The optimal inhalation window can be identified on the curve showing shortly before the peak inspiratory flow rate and is highlighted here in green. Furthermore, inhaler actuation and the moment of the drug release can be detected. This moment can be compared to the optimal actuation window to conclude whether the actuation was performed correctly. The inhalation profile gives us an indication whether the patient inhaled deep and slow enough. The flow sensor can identify the peak inspiratory flow rate. The integration of the flow rate over time would give us then the total inspired volume IV. Here, a calculation of the airway resistance is performed. The airway resistance is defined by the ratio of the time needed to increase the flow rate from 10 to 90% of the peak inspiratory flow rate and divided by the value of the set peak inspiratory flow rate. This gives us an indication of how severely restricted the airways are. I would like to explain how the previous shown measurement results can be exported in future directions to monitor the drug delivery in the course of the disease. Several research groups found that monitoring the peak inspired airflow, the inspired volume, and the airway resistance over time allow to identify the next exacerbation. And I think that Tiva recently made a claim about it. The three parameters are shown here in the chart. Let us continue now with an imaginary patient case and assume that he or she starts the treatment. We monitor the patient's compliance. In the beginning, airway resistance is high. Both inspired volume and peak inspired airflow is low. Collecting and analyzing the data can provide an insight on the correct use of the inhaler, the effectiveness of the medication, and the course of the disease. In the chart, we can see that the patient's condition is improving over time. Then, for some reason, the patient stops to take medication and starts the treatment again after a few days. We see clearly that the patient's disease has degraded. Now, with the availability of the patient's data, the medication intake can be improved and closely monitored until it is improving again. To sum it up, adding a diagnostic unit to the drug delivery device that the patient is already familiar with is a powerful tool in asthma and COPD disease management. It is a solution of guiding the patient and providing direct feedback, as well as supporting the patient in controlling the disease and increasing adherence. There is potential for gathered data to be used to predict asthma attacks, help clinical decision-making, and drive better targeting of healthcare resources. It is time to thank you very much for listening. Please get in touch with any question or feedback you might have. Bye for now from the Presspart team.